Assalamu alaikum students, I am Dr. Ammara Sarwar and the topic for the today's dissection class is the gross anatomy of the external ear. So let's start with our topic. Anatomically, the ear consists of three parts: external ear, middle ear and internal ear. The external and middle ear are mainly concerned with the transference of sound to the internal ear, which contains the organ for equilibrium as well as for hearing. Today we will discuss the external ear in detail. So the external ear is composed of two parts. The outer or visible part is called the auricle or pinna, which you can see on the side of your face, while the inner part is called the external acoustic meatus or external auditory meatus, which conducts sound to the tympanic membrane. So we will discuss each part in detail. So let's start with the auricle. Auricle, most of the upper part of the auricle consists of irregular shaped elastic cartilage which is covered by thin skin, while its lowermost part is the fibrofatty tissue which is covered by skin. So this elastic cartilage shows many elevations and depressions. The outermost elevation, which forms the contour of the auricle, is called the helix. Here you can see the outermost elevation is called helix, while opposite to the helix there is an other elevation which is called antihelix. These are crura of antihelix. Between helix and antihelix, there is depression. So posteriorly, this depression is called scapha or scaphoid fossa, while anteriorly and above the antihelix, there is an other fossa which is called triangular fossa. The deepest depression is called the concha. Now this arrow shows an opening which leads into the external auditory meatus, and there is a tongue-like projection overlapping this opening, and this is called tragus. Opposite to the tragus there is an other elevation which is called antitragus, and between antitragus and tragus there is intertragic notch. So here you can see the different elevations and depressions of the auricle. The outermost elevation is called helix. Opposite to the helix there is antihelix. The depression between the helix and antihelix posteriorly, this is called scapha or scaphoid fossa, while the depression between the crura of the antihelix or anteriorly and above to the antihelix there is triangular fossa. The deepest depression is called concha, and here is the opening which leads into the external auditory meatus. Overlapping this opening there is elevation which is called tragus. Opposite to the tragus there is antitragus, and in between the tragus and antitragus there is intertragic notch, and here the lowermost part of the auricle which is the fibrofatty tissue covered with the skin which is called lobule. Now the blood supply of the auricle. The lateral or outer surface of the auricle is supplied by the branch from the superficial temporal artery, while the medial or inner surface is supplied by the posterior auricular artery as well as the occipital artery, and veins accompanying the arteries. Nerve supply. the lateral surface. So the upper two-thirds of the lateral surface is supplied by the auriculotemporal nerve, which is the branch of the posterior division of mandibular nerve from the trigeminal nerve. And while its lower one-third is supplied by the great auricular nerve branch from the cervical plexus, and the concha and root of the ear is supplied by the auricular branch of vagus and facial nerve. While the medial surface of the auricle, the upper part is supplied by the lesser occipital, and while the lower part is supplied by the great auricular nerve. Lymphatics from the auricle drain into the preauricular, postauricular, and superficial cervical lymph nodes. The lateral surface of the upper half of the auricle drain into the preauricular or the parotid lymph nodes, while the cranial surface of the upper half of the auricle drain into the postauricular or mastoid lymph nodes as well as into the deep cervical lymph nodes, while the rest of the auricle, including the lobule, drain into the superficial cervical lymph node. External acoustic meatus or external auditory meatus. So it is an ear canal that leads inwards from the auricle to the tympanic membrane. So what is the extent of the external auditory meatus? It extends from the auricle to the tympanic membrane. Now here the anterior wall of the external auditory meatus has removed to show you the interior of the external auditory meatus or canal. So its length is 24 millimeter, out of which the medial two-third or 16 millimeter is bony. Here you can see the bone which forming the medial two-third of the external auditory meatus, while its lateral one-third or 8 millimeter is cartilaginous. So it is not a straight canal, it is slightly S-shaped canal. So if you enter in the external auditory meatus through this opening into the auricle, you will find that external auditory meatus has an anterior wall which has removed here, and it has a posterior wall, a roof, and a floor, a lateral end which shows an opening, while its medial end shows the tympanic membrane, and the tympanic membrane placed obliquely at the medial end of external acoustic meatus, and it makes an angle with the floor of the external acoustic meatus, and due to its obliquity the anterior wall and floor are longer than the posterior wall and roof. The outer or cartilaginous part of the external auditory meatus is lined by the skin which is adherent to the perichondrium, and it contains the hairs, sebaceous glands and ceruminous or wax glands. So here you can see a very close view of the cartilaginous part of the external auditory meatus, and here you can see that it is lined by a skin which contains hairs along with the sebaceous and ceruminous glands which produce wax in the ear, and the other inner or bony part is also lined by a thin skin which is continuous with the external layer of the tympanic membrane. In this diagram you can see this is the bony part which is also lined by a thin skin, and this skin is continuous with the external or outer layer of the tympanic membrane. Now this diagram is showing you the lateral view of the skull where you can see the bony part of the external auditory meatus, and this bony part is formed by the tympanic plate of the temporal bone, while posterior-superiorly it is deficient, and here it is formed by the squamous temporal bone. Blood supply of the external acoustic meatus. The outer part of the canal is supplied by the superficial temporal and posterior auricular arteries, and the inner part is supplied by the deep auricular branch of the maxillary artery. Innervation of the external auditory meatus is very important. The anterior wall and roof of the external auditory meatus is supplied by the auriculotemporal nerve. Here you can see the roof while the anterior wall has removed, but these both are supplied by the auriculotemporal nerve, and you all know that the auriculotemporal nerve is the branch from the posterior division of the mandibular nerve, while the floor and posterior wall of the external auditory meatus is supplied by the auricular branch of the vagus nerve. A very important clinical correlate regarding the innervation of the external auditory meatus, and a very frequently asked question that what is ear cuff? So I told you that the floor and the posterior wall of the external auditory meatus is supplied by the auricular branch of the vagus nerve. So if irritation of the auricular branch of the vagus nerve occurs in the external auditory meatus by earwax or syringing, it may reflexly cause persistent cough or ear cough and vomiting, which leads to even death due to sudden cardiac inhibition. Now, the lymphatics of the external auditory meatus pass to the pre-auricular, post-auricular, and superficial cervical lymph nodes, same as that of auricle. Tympanic membrane. It is a thin, oval, and semi-transparent membrane at the medial end of the external acoustic meatus. Now, in this diagram here, you can see the external auditory meatus, and here is the tympanic membrane, which is placed at the medial end of the external acoustic meatus, and behind this there is the middle ear cavity. So tympanic membrane forms a partition and separates the external auditory meatus from the middle ear cavity, and it is placed obliquely, and it makes an angle of 55 degrees with the floor of the external acoustic meatus, and the membrane has an outer and inner surfaces. Outer surface faces towards the external acoustic meatus. Here you can see this is the outer surface. It is concave and it faces towards the external acoustic meatus, and it is covered by the skin which is continuous with the external auditory meatus. While it has an inner surface which faces towards the middle ear cavity, it is convex and it is lined by the mucous membrane which is continuous with the mucosa of the middle ear cavity. And this convex inner surface provides attachment to the handle of the meatus. So the point of maximum convexity lies at the point where the tip of the handle of meatus is attached to the tympanic membrane, and this point is called umbo. Now here you can see that handle of meatus, tip of handle of meatus attached with the tympanic membrane, and this point is called umbo. The outer or cartilaginous part of the external auditory meatus is lined by the skin which is adherent to the perichondrium, and it contains the hairs, sebaceous glands, and ceruminous or wax glands. So here you can see a very close view of the cartilaginous part of the external auditory meatus, and here you can see that it is lined by a skin which contains hairs along with the sebaceous and ceruminous glands which produce wax in the ear. And the other inner or bony part is also lined by a thin skin which is continuous with the external layer of the tympanic membrane. In this diagram, you can see this is the bony part which is also lined by a thin skin, and this skin is continuous with the external or outer layer of the tympanic membrane. Tympanic membrane composed of three layers. Outer cuticular layer of skin which is continuous with the skin of the external auditory meatus. Middle fibrous layer made up of superficial radiating fibers and deep circular fibers. But remember, this middle fibrous layer is only present in the pars tensa. In pars flaccida, this fibrous layer is replaced by the loose areolar tissue. And the third or inner layer is the mucus layer, which is continuous with the mucus layer of the middle ear.
Blood supply of tympanic membrane. The outer surface of the tympanic membrane is supplied by deep auricular branch of maxillary artery, and the inner surface is supplied by anterior tympanic branch of maxillary artery and by the posterior tympanic branch of the stylomastoid branch of the posterior auricular artery. Veins from the outer surface drain into the external jugular vein, and from the inner surface drain into the transverse sinus and into the venous plexus around the auditory tube. Lymphatics pass to the preauricular and retropharyngeal lymph nodes.
Nerve supply of the tympanic membrane. As you already know that tympanic membrane is placed obliquely at the junction of the external acoustic meatus and the middle ear cavity. So the outer surface which faces towards the external acoustic meatus, its antero-inferior part which is close to the anterior wall and roof of the external acoustic meatus is supplied by the auriculotemporal nerve, while its posterior-superior part which is close to the floor and posterior wall of external acoustic meatus is supplied by the auricular branch of the vagus nerve, while the inner surface of the tympanic membrane which faces towards the middle ear cavity is supplied by the tympanic branch of glossopharyngeal nerve through the tympanic plexus. Tympanic membrane perforation has many causes including the trauma and infections. Most commonly are the middle ear infections or due to the excessive pressure during scuba diving. So the minor ruptures of the tympanic membrane heal spontaneously, but the large rupture require the surgical repair. So the most common cause could be otitis media, and it can lead to perforation of the tympanic membrane if the infection persists for the long time period. It usually be treated with antibiotics, but if the infection persists, the chronic inflammatory change may damage the ossicular chain and other structures within the middle ear to produce deafness. So sometimes the membrane is incised to drain pus present in the middle ear. This procedure is called the myringotomy. The incision is made in the posterior inferior quadrant of the tympanic membrane to avoid injury to the chorda tympani nerve, which runs posterior or behind the pars placida. And the other reason is that the superior part of the tympanic membrane has rich blood supply. So to avoid injury to the chorda tympani and blood vessels, the incision is made in the posterior inferior quadrant of the tympanic membrane to drain the pus from the middle ear cavity, and this procedure is called the myringotomy. Now, here are some other clinical correlates regarding the external ear. Autoscopic examination. So, ear can be examined through an otoscope. Otoscope is a device through which light can be shown and the image magnified to inspect the external acoustic meatus and tympanic membrane. Here you can see otoscope, which is used to examine the external acoustic meatus and tympanic membrane. The examination begins by grasping the posterior superior aspect of the ear and gently retracting it to straighten the external auditory meatus. And you all know that the external auditory meatus is not a straight canal, it is slightly S-shaped canal. So to examine the external auditory meatus, it should straighten by pulling the ear upwards and backwards. While the meatus is relatively short in infants, therefore extra care must be exercised to prevent injury to the tympanic membrane. The meatus is straightened in infants by pulling the auricle infro-posteriorly, means it pulling the auricle down and back in infants to straighten the external auditory meatus. So, what are the normal findings during an otoscopic examination? The tympanic membrane normally looks like relatively translucent and has a gray reddish tinge. The handle of the meatus is visible near the center of the membrane, and there is a cone of light which is produced by the concavity of the tympanic membrane in the 5 o'clock position or in the anterior-inferior quadrant. Here you can see a cone of light. External ear injury. Bleeding within the auricle resulting from the trauma may produce an auricular hematoma, which is a localized collection of blood between the perichondrium and the cartilage of the auricle, resulting in distortion of the contour of the auricle. So, as the hematoma enlarges, it compromises blood supply to the cartilage, and if it left untreated, fibrosis develops in the overlying skin, forming a deformed auricle, which is called cauliflower ear or boxer's ear. Acute otitis externa or swimmer's ear. It is an inflammation of the external acoustic meatus. The infection often develops in the swimmers who do not dry their meatus after swimming, but it may also be a result of bacterial infection of the skin. So the affected individuals complains of itching and pain in the external ear. Pulling the auricle or applying pressure on the tragus increases pain. Now here you can see the inflammation of the external auditory meatus. As you all know that the cartilaginous part of the external auditory meatus also contain hairs and sebaceous glands. So it is, and here are the ceruminous Beck's glands also present, which produce Beck's. So if this area is not dried after swimming or bath, then it is more vulnerable to the infections. Boils and other infections of the external auditory meatus cause little swelling but are extremely painful due to the fixity of the skin to the underlying bone and cartilage. So, ear should be dried after head bath or swimming to avoid the acute otitis externa. So, this is all about external ear. Thank you.